When Mission Health System began its quality improvement journey, they decided to start inside the Medical Surgical Intensive Care Unit at their flagship hospital in Asheville, North Carolina. Ron Paulus is Mission's CEO.
We looked at some of the national patient safety goals, some areas that we were having our own challenges in, and so we wanted to make a very specific focus on a few areas.
So our first initiative was spontaneous awakening trials, also known as sedation holidays. The landmark article came out in 2000 in New England Journal, proving and showing, really without much doubt, that daily spontaneous awakening trials improve patient outcomes, gets them off the ventilator faster.
Mission connected with IHI to establish the parameters of the program to address how surgical ICU patients are cared for.
They demonstrated that they could get some improvement and not add work, but make it easier for the nurses, for the doctors, and for the patients, and realized that, especially in the ICU, this is team care. You know, all of healthcare is team care, but in that environment, you needed everybody present. And by demonstrating with small tests that they could actually get the process moving ahead, they were able to convince others to come on board.
The biggest obstacles really are the buy-in, the embracing change by everyone who's involved in the process.
So our staff is asking not the question, or not saying I can't do it, but really asking the question, how can we do it?
Nurses in the medical ICU are constantly reviewing patient cases to determine when to wake a patient or when to try to remove the vent. Chet Gronke is one patient they remember very well.
I remember that he was very, very ill. I remember that he was on the ventilator for a few days. He was in septic shock. He was heavily sedated. In the beginning, he was one of the patients that the nurses would say, "Gosh, I think he's too sick to wake up. I don't want to try to wake him up."
Gronke had been admitted to the ICU with Legionella pneumonia, which caused his kidneys and respiratory system to shut down. Without the ventilator, he would not have been able to breathe. Based on the Apache mortality predictor, the ICU staff believed he would need the vent for as many as 5 days. But as he was taken off sedation, Gronke wanted the vent taken out in only 3.
I can recall vividly telling the woman, I don't want this, I don't need this, and I was removing physically some of the apparatus that was attached to me. So, yeah, I can recall that.
When a patient is taken off sedation and prompted to breathe without a vent, they can get up and move around more quickly, avoiding infections, pneumonia, pressure ulcers, and the delirium and post-traumatic stress disorder that's associated with heavy sedation.
And there are instances of people reporting feeling like they were in an underground parking garage, or they were underwater, or they were tunneling through trying to get out, and just suffocating feelings. And it's horrible to listen to them. And all that time, we thought they were just resting peacefully, and they were sedated, and we were keeping them very comfortable.
Mission is the busiest surgical hospital in North Carolina, with centers of excellence in heart and stroke care, oncology, neurosciences, women's care, and pediatrics. It's also the region's primary Level 2 trauma center. Taking an institution of this size and scope and integrating newly engineered processes is no small task. Dr. Paulus says IHI helped Mission through the quality improvement journey, and he insisted on setting the bar high.
0 infections, 0 pressure ulcers, a complete elimination of harm. Monitoring and measuring data along the way, and then feeding that information back in a transparent manner.
It's really clear when,
Every week, the medical surgical ICU team gathers to get a sense of how they're really doing. This is one way data is fed back to the caregivers and shared transparently.
It's important to be able to step away from the bedside, get away from the chaos of the unit for a few minutes to get a look at the bigger picture. Our bedside staff stay so busy with tasks at the bedside that they don't get the chance to look to see that our infection rates have gone down month after month after month, to really take a look at the graph and say, well, why is that? And what are we doing that's different? And gosh, I didn't know that we made such a big difference.
I think it's better. I don't think we could actually comprehend what the outcomes would be until we actually saw it. Patients awake, being able to tell us what they need.
You know, the outcomes are just phenomenal with just the 2 little things we started on. You know, if we add the other pieces in, there are no limits to what we can do for our patients.
All members of the medical surgical ICU team agree they have taken giant steps forward over the last year. Now the goal is to extend these quality improvement initiatives to other areas of the hospital without losing focus on the medical surgical ICU.
We can do it great in this medical surgical ICU, but then how do we take it to our other medical surgical ICU? How do we tailor it then to fit in the neurotrauma ICU? How do we make it fit for the cardiac ICU? And we still have to do that. The team at the beginning is so excited. They're ready to move on to the next project, that we really need them to help us institute it the other ICUs.
I'm most proud of how our team has come together and learned and increased its capacity to learn again. Seeing skeptics and nervous folks at the beginning, to see the pride and the smile on their faces, not because they're proud of themselves, but because they see their patients doing better right in front of their eyes. And they're motivated and they're energized by the improvement that they're seeing, and they're spreading that word amongst their colleagues, and they're ready to go to the next round.
Learn more about Mission Hospital's quality improvement journey by visiting missionhospitals.org/mission values.